everybody. It's Dr. Mary Wendel at Medi Tresse. I want to touch on a very hot topic, which is hair loss due to GLP-1 medication. These medications have revolutionized the treatment of obesity. Unfortunately, they're not being monitored carefully enough. A lot of people can just go online and be prescribed medications without being monitored. And these medications do have side effects. They will help you lose weight very rapidly, but with any medication, there can be side effects. And one of the side effects that's being noted very frequently, particularly in women, is excessive hair shedding. The rapid rate of hair loss that occurs with the GLP-1s is correlated with how fast the weight loss takes place. So if somebody's losing a lot of weight quickly, they're more likely to have shedding. The biggest problem I see in these medications is that patients are not monitoring their diet. They're not getting blood work done prior to starting. It's important to know that their vitamin levels are adequate, that their protein levels are adequate. And when these things are not being monitored and addressed carefully enough, you're more likely to have excessive shedding. We do know that women who used to have bariatric surgery and have rapid weight loss had the same problem. Generally, it's reversible if some of these problems can be addressed and treated properly. So what else can affect the loss of hair because of the GLP-1s? Well, it does affect hormones. You can affect your thyroid. It can affect your estrogen. Some women who lose weight rapidly actually lose their menstrual period for that time being. Another thing that can happen is just the stress of this rapid weight loss. It can affect your cortisol level, which we know can also affect shedding. There are studies being done. Most of them are not great studies. They're not good enough for us to really come up with a reason as to why this is happening. The belief is most likely it creates what's called a telogen effluvium, which can occur during times of stress and poor nutrition. So those things really should be addressed. And again, the good news is that once the weight has stabilized, usually the shedding will stop. Another thing that's really interesting is that these medications may actually improve hair health under certain circumstances, very specific diagnoses, including scarring alopecias or hair loss due to diabetes. Again, these people are not taking these medications for weight loss, so they're less likely to see the excessive shedding. So what do I recommend? Taking these medications, you're seeing excessive shedding, you should probably get some blood work done, have your nutrition evaluated either by your primary physician or dietitian. It might be worthwhile seeing a hair loss specialist to make sure nothing else is going on, because studies have shown that women who are experiencing hair loss from GLP-1s can be experiencing hair loss due to something else as well. There may be two things going on, so it's important to get those things checked and get a good scalp evaluation, perhaps a trichoscopy. A lot of women are just getting these medications online. They're not being managed appropriately medically. So that would be my recommendations to you. There'll be other topics coming, and if you have a question about something specific, email us at info@meditresse.com, and we will hopefully be able to answer your questions in the near future. Thank you.